All right, so we're going to get into chapter 1, the physiology of physical agents. So this is our first introduction to physical agents, and this is something that is going to be a key component for everything that we discuss moving forward from here. So a little bit of an introduction chapter. We'll talk about some of the different physical agents that we're going to be using throughout this course, and we'll talk about some of the skill competencies that you're going to have to perform and pass in order to get to the end of this course in semester 2. So some of the objectives that we're going to cover in this lecture, we're going to discuss the categories of physical agents and the role of each category in the rehabilitation process. We're going to briefly describe some of the mechanisms of tissue injury and repair. We're going to look at some of the physiological effects, indications, contraindications for each physical agent. We're going to maybe hint on some of the really basic contraindications that you'll kind of see show up again and again in some of these really specific modalities like hot and cold application, E-stem, all of those things. There's going to be definitely much more that you're going to have to learn about specifically for each modality, but there are some common themes that you'll see, so we'll identify those. We're going to look at the effects of physical agents on pain relief and functional activities, and we're going to get more into that as we get further into these chapters this semester. And then we're going to identify pertinent information in the patient's health record prior to carrying out the plan of care. So we're going to look at the plan of care. We're going to see if there are any contraindications or if the patient presents with some of the indications that would lead us to a certain modality. So what are physical agents? We can kind of use the term physical agents and modalities interchangeably here. So you may see that on an exam as list a physical agent that is appropriate for this patient. You might also see it as list the modality that is most appropriate for this patient given their presentation. But physical agents, modalities are basically some form of energy, materials that are applied to the patient. The ones that we're going to really cover and focus on in this course include a hot and a cold application. So we'll look at hot packs, cold packs. We'll also do an ice massage. We can use water in the form of debridement when we're out in the field. We're not going to really focus on this one as far as skills assessments go this semester, but we will discuss it. We can also discuss pressure as a modality. So we're going to have a soft tissue mobilization skill competency. We can use sound via ultrasound, electrical currents. We're going to spend a few weeks on electrical currents and the different types of electrical currents that we can apply to our patients. And then, of course, electromagnetic radiation, something that, again, we're going to lecture on, but we're not going to see much in the classroom setting. The physical agent describes the type of energy. So again, like I said, it's used interchangeably with physical modality. You may even see biophysical agent modality. So just be familiar with those terms. Some of the basic categories of physical agents that we're going to talk about include thermal agents. So whenever you hear the term thermal agent, just note that can relate to superficial heating like a hot pack or paraffin. It can relate to a deep heating modality like ultrasound or diathermy. And then it can also relate to cold pack application or cooling techniques, ice pack, or again, that ice massage. So anytime you hear the term thermal agent, just understand that it could be talking about something to either heat the tissues or cool the tissues down. Whenever we hear the terms cryotherapy or thermotherapy, then we're going to maybe think about thermotherapy being more of the heating and cryotherapy being more of that cooling kind of technique. We also have electromagnetic agents. So we're going to discuss electrical currents, the different waveforms, and the different types of E-stem modalities that we can use to either decrease pain or elicit a muscle contraction for neuromuscular reeducation. So we'll discuss those later on in these upcoming chapters. But some of the electromagnetic agents that we're looking at include TENS. It could include electromagnetic fields like ultraviolet lights or even some lasers. So not like the lasers that you see in Star Wars or anything like that, but therapeutic lasers, and it's becoming a little bit more popular. Some of our students have had the opportunity to use something like cold laser in a clinical setting, to maybe decrease inflammation in the area or spark some kind of healing process. So we have thermal agents, electromagnetic agents, and then we also have what we call mechanical agents. So mechanical agents include something like sound. So we're thinking ultrasound. We kind of discussed this in semester 1 a little bit when we were talking about physics, right? We have these mechanical agents, sound. We looked at how ultrasound really kind of works in the body. The piezoelectric crystal that we discussed vibrates at a very high frequency. That frequency sends sound waves into the tissues, and then it gets converted into some form of heat deep into those tissues. So ultrasound, shock wave is another thing that you may or may not see in clinic. We don't have any kind of machine that performs shock wave therapy here, but that's basically small percussions right on the surface of the skin. Those percussions again generate sound waves that travel into the tissues, and it elicits some form of healing response, possibly even a heating response. Some other mechanical agents include water, like a whirlpool. Traction, mechanical traction is something that we're going to see a lot of this semester for both cervical and lumbar spine pathologies. And then we also have compression via elastic bandage or stockings. Now, compression was a skill competency in the past, but it has been taken out of the curriculum as far as a skill competency. But we're still going to practice the technique of compressive wrapping using like a figure 8 wrap to decrease edema in those distal extremities. So all of those can be considered mechanical agents, but the 3 types that we're looking at include thermal agents, electromagnetic agents, and something like mechanical agents. So we'll look a little bit more in depth here at these thermal agents. So when we think of thermal agents, again, think of both hot pack, cold pack. We're heating the tissues or we're cooling the tissues. Whenever we hear cryotherapy or thermal therapy, then we start to discuss whether it's a hot pack or a cold pack. But these thermal agents transfer energy to a patient to increase or decrease tissue temperature. So if we're looking at applying a hot pack to an area, we have to know the indications and why we would do such things. Same with an ice pack. Ultrasound is something that we can use that is more of a deep heating agent. Same with diathermy and the whirlpool. Those can all be considered different types of thermal agents. And the thing that we really have to consider is that temperature change that we're trying to establish a superficial or a deep kind of change to the temperature in the tissue. So I have this little image off to the side here. We can see this is an ultrasound head, and it talks about the different frequencies that you can use during therapeutic ultrasound. If you look at the far left side of the image, 1 megahertz of frequency is going to translate into a deeper penetration into the tissues. We also have 3 megahertz. Those are kind of the 2 most common parameters that you're going to use, and our machines only let you set either 1 megahertz or 3, or some of them let you choose 3.3 instead. But 1 megahertz is going to go deeper into those tissues. 3 megahertz is going to be more for the superficial response, and then some of the machines will actually allow an alternating frequency like 1 megahertz to 3 megahertz, and then it kind of switches back and forth between those two to target deep and superficial tissues. So when we think about the reasons to use thermotherapy, we can see these indications here. So when we're thinking of thermotherapy, we're either trying to increase circulation, we're trying to increase the metabolic rate, we're trying to increase soft tissue extensibility or decrease pain. So again, when we hear the term thermotherapy, and not just a thermal agent, we're thinking thermotherapy is related to something like the application of a hot pack. So if we have a patient that has decreased circulation in the area, they have shortened soft tissues, and they're not able to get full range of motion, we can apply a hot pack to increase blood flow via vasodilation, and we can start to to kind of heat those tissues and then stretch them afterwards to gain tissue extensibility. So if somebody's really limited with range of motion and you want to stretch that patient for your session, maybe applying a hot pack before to kind of get those tissues warmed up and then provide that stretching afterwards would be a good technique to use. Also, we're going to see that thermotherapy helps to decrease pain, and we'll talk about some of the reasons why we get decreased pain sensation when we look at Chapter 7 and Chapter 8, which discuss thermal agents in more detail. When we look at cryotherapy, it's essentially, the indications are essentially opposite of those that you would see for thermotherapy. So reasons that we would use thermotherapy include decreasing circulation, decreasing metabolic rate, and again, we're going to see decreased pain there. So when we have thermotherapy, we see vasodilation, which increases blood flow, increases circulation. When we apply something like cryotherapy, we are going to see vasoconstriction, which decreases circulation and blood flow to the area. We would really use this cryotherapy when we see a patient that has inflammation present. We're trying to decrease that inflammatory response via decreasing circulation and through vasoconstriction. So again, we're going to talk about more of those indications in further detail when we get to Chapter 7 and Chapter 8. But it's important to note that the two differences between these modalities are the thermotherapy and cryotherapy. So make sure you know those for any quizzes coming up in the future. I do have a little video here, comparison of the two. So you can click on that video, you can watch it. They do a little bit of a breakdown of the uses of thermotherapy and cryotherapy and how they differ. Essentially what you're going to see is just a little bit more detail in a table format that discusses the indications that we just talked about and the physiologic responses. When you look at electromagnetic agents, we're applying energy in the form of electromagnetic radiation or some type of electrical current. So we're not going to see a lot of these electromagnetic radiations in class. We are going to discuss them in lecture on them, but it's not anything that we have in the lab setting. We don't have a diathermy machine. We don't have any type of infrared lights, photobiomodulation lights, or any kind of UV radiation. But we are going to focus a lot on these electrical currents that you can see on the right-hand side here. So the different types of E-stim that we're going to be focusing on this semester include IFC, or interferential current. We have NMES, neuromuscular electrical stimulation, Russian stimulation. We have TENS, transcutaneous electrical neuromuscular stimulation. And we also have high volt pulse current, or you may see that as HVPC. So we're going to look at all of these different applications of E-stim. We're going to learn about the indications. We're going to learn about the correct parameters, contraindications for each of those. So real briefly, I'll just give you a little rundown here. IFC is a type of electrical current that we're going to use to decrease pain. NMES and Russian stimulation are going to be more focused on getting the muscle to contract. So if somebody is really weak or they have muscle atrophy in a certain area, post-surgery or post-injury, we can apply something like neuromuscular electrical stimulation or Russian stimulation to enhance their ability to contract the muscle. We can start to decrease the effects of muscle atrophy. So it's really, really helpful in those patient populations, especially post-surgery. TENS is something that we can apply as well to help decrease pain. So we'll talk about the different types of pain theories. So we have one called gate theory for pain control, and we have one for called opiate release. So we'll discuss those again more when we get into these chapters later on. And then when we think about high volt pulse current, this is where we are going to use some type of electrical current to help increase tissue healing, decrease edema, and we're creating a charge in the tissues which causes a physiologic response for either a reduction in edema or we're trying to increase tissue healing. So the different types of charges that you create in the tissues whether you set a positive or a negative polarity, will determine what's going to happen physiologically with that patient. So kind of something that we just discussed, some of the indications or reasons that we would use electrical currents or electrical stimulation include inducing a muscle contraction. So we're thinking of that NMES or Russian. We can also change the perception of some sensations by introducing some of those really light electrical currents to the skin. So let's say somebody is having increased pain to something that is a non-noxious stimulus. We can maybe apply something like TENS or IFC to the area, and that can start to change maybe the perception of pain for that patient. We can also reduce edema via muscle contractions and changing the charge in the tissue, and we can accelerate tissue healing. So if somebody has some kind of ulcer on their leg, whether it be from diabetes mellitus or a pressure ulcer, we can again use that high volt pulse current to change the charge in the tissue to our advantage. So if we're trying to increase healing, we want one type of charge in the tissue. If we're trying to decrease edema, we maybe want another one. So we'll talk about the parameters for HVPC a little bit later on in the semester. The last thing that we can use electrical stimulation for, at least what shows on this slide, is what we call biofeedback. So if anybody has ever been in physical therapy and maybe it was post-injury, post-surgical procedure, you may have been asked to perform something like biofeedback with your therapist. What biofeedback really does is it allows the therapist and the patient to get real-time feedback on whether or not they have good control over that muscle contraction. So let's just take the quadriceps for an example here. Post ACL, anterior cruciate ligament reconstruction, typically what you're going to see is a lot of decreased ability for the patient to control the quadriceps contraction. So they're going to have difficulty contracting the quads, and they're going to have weakness in that quadriceps muscle group. So what we can do is we can slap on these biofeedback type electrodes and hook it up to the machine, and it gives you a visual feedback in the form of essentially LED lights, and you set the different parameters, the gain, the threshold, all those different things that we're going to discuss later. And it allows the patient to say that, or to see that this amount of contraction relates to this threshold, this gain experience. So we'll talk more about that, and hopefully we have some opportunity to see what that looks like in the lab setting. When we look at electromagnetic radiation, reasons that it would be used is to produce heat in the tissues, creating erythema, so increasing blood flow to the area. So you might see that in the form of redness. We can also modify cell membrane permeability and cell function, which is a really important aspect to tissue healing. Whenever we're thinking of modifying cell membrane permeability, that's just the ability to allow other waste products to escape the cells during that inflammatory process, or it allows other cells like our white blood cells, neutrophils, macrophages to enter the area to help debride the area of all the different waste products. So increasing that cell membrane permeability and cell function is a really important aspect to tissue healing that we'll discuss a little bit later. And then of course, controlling pain and edema is something that we're going to see pretty much for all of our different modalities, right? We're trying to control pain. We're trying to reduce edema in certain areas of the body. So anytime that you think of applying a physical agent or a modality, one of the main goals is to help decrease pain, control that pain, and get rid of some of that edema in the area, which could be causing the pain that they're talking about. On to mechanical agents now here. So we're going to talk about quite a few of these in our lab setting and lectures. So when we're thinking of mechanical agents, this is any force that we're applying to a patient to increase or decrease pressure on the body. So we can use water or hydrotherapy to do that. We can use mechanical traction or manual traction in the cervical the lumbar spine, or possibly even some of those proximal joints like the hip. And then we can use sound, which would be considered your ultrasound or that shockwave therapy. So what I have here on the right-hand side is an image of a disc herniation and kind of what happens to the body when we perform something like spinal traction. So on the left-hand side, we can see that we have compression. These two arrows pointing down and up are creating pressure on this disc that sits right in between the two vertebrae. And because of that increased pressure, we have this nucleus pulposus that is herniating out to one of the sides. And when this happens, we have these spinal nerve roots that sit out to the lateral side of each spine segment, to each vertebra. And if we have this nucleus pulposus jetting out into that area where there's our spinal nerve root, we get compression, and that's where we can see something like sciatic nerve pain that radiates down the leg. So this is something that we're going to try to improve upon with something like spinal traction. So we have the compression forces happening here, and it's almost like if you were to step on a jelly donut, right? If there's the jelly in the center, you step on it, obviously all that jelly is going to squirt out to one side or the other. That's essentially what's happening when you have compression in the spine that affects those discs. But when we go to spinal traction, now you can see that we have the arrows pointing in opposite directions, so we're pointing up and downward, not towards each other, but away from each other. So when that happens, we could see the herniated portion of that nucleus pulposus actually reduce back to the center of the spine, and then it decreases that compression on that nerve root at that spinal level. Something else that's really cool that happens is that it draws in a lot of these nutrients from the surrounding area, the surrounding fluids and tissues, to help with that process of healing. So we call that nutrition to the joints if we're thinking of like a joint mobilization, but we're also getting more nutrients to that disc to help the healing process accelerate or possibly start from scratch. So again, we'll talk about spinal traction in greater detail when we get to that chapter. So basically what we've seen over the last few slides are these different effects of physical agents. So we have reduction in inflammation, which we're going to see a lot with our cryotherapy applications, as well as some of our ultrasound modalities with some of our e-stim modalities, but we're trying to decrease that inflammation in the areas. We can accelerate tissue healing via that cell membrane permeability. When we increase cell membrane permeability, we get more nutrients to the area. We get all of the different white blood cells to the area that help spark that healing process. What we're really thinking of for most of our modalities is relieving pain. So that's always going to be an indication for a modality, but we'll talk about when it's most appropriate to use certain modalities based on contraindications and indications that the patient is presenting with in the clinic. Also, we can use these physical agents to modify muscle tone. We haven't really talked about muscle tone yet, but we are going to discuss that in other courses in semester 2, and then we'll try to relate this to the modalities that we're applying. But we'll talk a little bit about muscle tone in this section as well as in your other coursework here. And then the last one that we see is alter collagen extensibility. So again, this is when we're thinking of somebody who's limited with range of motion. Let's take the hamstrings, for example. If you're tight in your hamstrings, you're not going to be able to fully extend your knee. You're not going to be able to get full knee extension. So something that we can utilize is either a hot pack to the area followed by stretching to gain extensibility of those tissues, or we can think of something like ultrasound, which really targets collagen fibers and different and collagen tissues more specifically, and then again we can stretch the patient maybe afterwards there. We're going to talk more about inflammation and tissue healing in chapter 3. So we'll describe these different phases of healing, inflammation or the inflammatory period, the proliferation phase, and the maturation phase. So we'll discuss those in greater detail in chapter 3, but there's also table 1.2 that kind of discusses some of the the modalities that would help with these phases of healing, so you can check that out. And then we're going to discuss pain in more detail in Chapter 4. You can see, again, Table 1.3 will discuss some of those modalities and maybe some of the reasons why they are effective at managing pain. So we'll talk all about pain, the different nociception systems, and the different types of pain that your patients may experience in Chapter 4. Muscle tone, again, something that we're going to discuss in greater detail in Chapter 5. But you can go to Table 1.4 in your text and see, what those modalities do as far as increasing or decreasing tone in the patient. So we'll talk about that, but it's just a little bit of an introduction to what muscle tone is. And then the last one, collagen, extensibility, motion restrictions. Again, when we're thinking of collagen, it's really important to understand the properties of collagen and what's important for tissue healing for those structures. So just remember that collagen is the main supportive protein of the skin, tendons, bone, cartilage, different connective tissues. We're really trying to limit contractures of these tissues. So an example of what a contracture might look like is, again, let's take the patient that has an ACL reconstruction and they're just a few weeks post-op. So they're going to come into the clinic with restrictions in knee extension, and they're probably also going to have restrictions in knee flexion. You'll probably see more knee flexion limitations than knee extension because that's what we call a capsular pattern for the knee. Regardless, we are trying to avoid these contractures from setting in. So we want to gain range of motion. We want to get to full knee extension fairly quickly. And then we have to be cautious with how fast we move into knee flexion. But what a contracture really is, or how they label contractures, is let's say the person that has the ACL reconstructive surgery comes in, now they're 3 months post-op, so they should have full range of motion for knee extension and knee flexion. Let's say that they can't get full knee flexion, and they really need to do that because they're squatting, they have to pick things up off the floor, maybe they're returning to sport, and they have to have that full knee flexion. Well, we're going to label contractures based on the position that the joint is stuck in. So let's say they can't get full knee flexion, so it's stuck in more of an extended position. Okay, so we're going to call that a knee extension contracture. And we'll talk about in semester 3 how we can really utilize modalities plus therapeutic exercise to avoid contractures. So there's going to be more detail on that, but contractures are something that are really, really important to try to limit in those early phases of rehab because limited range of motion translates to limited function. This is a slide that you probably need to start here. These are some of the general contraindications for physical agents. By no means are these all of the contraindications that you're going to see, but they are some of just more of those generalized ones. So anytime that you're performing any modalities, you might want to check to see if that person is pregnant, if they have a history of malignancy or current malignancy, that would be a big red flag. And if you do see somebody that has malignancy or a past medical history of that, and you're thinking about applying the modality, you might want to go check back with your supervising PT. That would kind of be your gold standard on operations and procedures. So always refer back to your supervising PT if you're just unsure of the next steps to take in your treatment session. Also, a pacemaker or other types of implanted electrical devices would be something that would be a generalized contraindication. It's not going to be a contraindication for all of our modalities, but something like electrical stimulation, ultrasound, you're really going to have to pay attention to their history and if they have a pacemaker or any of these other devices. And then impaired sensation and or mentation would be something that would maybe be a yellow flag for most of your physical modalities. If somebody cannot perceive the sensation of a modality, that puts them at greater risk for burns. It puts them at greater risk for a lot of these different things that could happen, because we're producing a lot of force for applying electrical modalities. We're applying heat and intense cold to some areas. So we want to make sure that they can sense the modality so that they have a good understanding of what they should feel and what's an abnormal feeling during the application of those modalities. When we think of mentation, now we're really thinking of somebody's mental state. Are they capable of giving an accurate response based on what they're feeling? Are they able to give any consent to the treatment? Do they understand the questions that you asked about the contraindications? Maybe they do have a pacemaker, but mentally they can't really tell you if they do or not. So impaired mentation would be something else that you'd have to really consider. And again, maybe check back with your supervising PT to see if it's something that is still appropriate based on their level of cognitive function. So know those contraindications. And this is something too that I really want you to pay attention to for your skill competencies when you're going through your exams and your quizzes and things like that. Even when you're answering questions for your homework, you should be thinking of these 3 different questions for how you're going to choose the most appropriate physical agent for your patient. So how do you choose or determine which physical agent to use? Well, one of the things that you have to consider first off is the stage of healing. So are they in the inflammatory phase? Are they in a chronic phase of pain and tissue healing? We're going to talk about, again, that inflammatory period, the proliferation phase, the maturation phase. So you have to consider what stage of healing that person's in, maybe based on timeline, based on presentation. Does it look inflamed? Is it red? Is there swelling? Is there heat coming off of it? Do they have pain still? All those things are going to help you determine the stage of healing along with the timeline. So that's the first question that you need to ask. The second one is the goal for the treatment. So what's the goal for the treatment? Is it to increase blood flow to the area? Is it to decrease blood flow to the area? Do we need a muscle contraction involved with this, or are we just trying to reduce pain? All of those questions need to be answered in order to establish the goal for the treatment. So we have the stage of healing. Are they in the inflammatory process? Yes or no? What's the goal for the treatment? Let's say for inflammatory process, or for the stage of healing, they're in that inflammatory process. So we determine that. What's the goal for the treatment? Well, I really want to decrease blood flow to the area and decrease that metabolic rate. So I'm already thinking of maybe applying cryotherapy to the area. And then the last question that you're going to have to ask yourself and ask your patients are, what are the contraindications? What are the precautions that I need to consider before I apply this modality? So contraindications mean that if they say yes to one of the questions that you ask, so let's say, for example, cryotherapy. One of the contraindications for cryotherapy is something that we call Raynaud's disease or Raynaud's phenomenon. This is basically constriction of the distal blood vessels, those arterioles, that when exposed to cold constrict even more, right? So maybe they already have this vasoconstriction happening, but they see or they feel that cold sensation, their body perceives that cold sensation, and it constricts even further. So what you're going to see with Raynaud's phenomena is their fingertips will turn blue, they get a tingling sensation in those distal extremities. That would be something that we'd have to be really cautious of. That's a contraindication to for cryotherapy, so we would not apply a cold pack for that person. So then we'd have to say, okay, so they're still in the inflammatory stage of healing. We still want to decrease inflammation in the area. What's a different modality that we can use to maybe address this patient's current status? Okay, so those 3 questions will be really, really important whenever you're deciding on a modality that you're going to use either in the lab setting or when you're working through your homeworks and the quiz questions that relate to, the most appropriate modality to choose. So there those are again. The last thing that I did not include on that previous slide is the cost, the convenience, and the availability. Sometimes you're just not going to have an ultrasound unit available. You may not have an ice massage cup that you really want to use for your patient, so you're just going to have to consider that as well. You can use these different physical agents in combination at times. We're going to, like a best example of that, if you go to this kind of third bullet point here, would be the example of rest, ice, elevation, compression. So typically we see that as RICE, rest, ice, compression, elevation, as a form of treating something that's in that acute inflammatory period. So we're using ice, we're using compression in combination to help decrease, first of all, pain, inflammation, and possibly edema in that area. So we can use them in combination at times. You just have to see when it's appropriate. Something that I also want you to note here is that it's going to be really important as we move through this semester to consider documentation and how your documentation supports the use of your modality. So we're going to look at that a little bit more in detail. We're going to do a lot of this in our lab setting as well, but we need to really have effective, accurate, and complete communication so that other healthcare providers or professionals can read our notes, understand our treatment, and maybe if your patient is with a different therapist for that day, have some continuity and continuation of their previous session, their previous treatment goals, things like that. So we obviously as PTAs cannot perform examinations or evaluations, we can't do discharges, but we can assess, we can collect data, and then we can provide that data to our supervising PTs. So your assessment is going to be really important. Something like looking for inflammatory type responses, their response to the treatment session. So maybe you take that cold pack off of the person that has inflammation in the area. You want to make sure to note their response to that modality. Did they tolerate that treatment well or did they not? How do you support whether they tolerated it well versus not? Well, maybe they didn't know that they had something like Raynaud's phenomenon, but you assessed it after you took off the cold pack and you saw the blue fingertips, you noted that they experienced tingling in the fingers. Those are really important things to document in your assessment, your subjective section there. So we'll talk more about that. And then we'll also discuss some of the CPT codes or the codes that you're going to use to bill for these different types of interventions. And that concludes our Chapter 1 lecture. I hope this was helpful for you, and please, if you are having questions or you're having doubts about answering questions on the homework, reach out to me at any time, and we can always set up a time to meet. But thank you so much, and I hope this helped.